Welcome to the Healthy Kids Minute.
Frostbite is thermal injury to the soft tissues of the skin. It usually affects the tips of fingers, toes, nose, ears, chin, and it's from being exposed to cold.
Dr. Evan Weiner is the interim director of the Department of Emergency Medicine at St. Christopher's Hospital for Children. He says anytime a child's skin is exposed to something that draws heat away, it can lead to an increased risk of ice forming in the tissues that may then cause damage.
The water inside the cells and outside the cells will freeze, and then a burn will happen. So touching metal or touching water or ice or something frozen will increase the risk of cold injury.
Parents should be aware and take extra precautions against the cold, especially on days when the thermometer dips below 32 degrees.
On those colder days, and especially on the severely colder days that we've had recently, it's very important to dress your children properly. So that's layers, that's paying attention to their hands and feet with gloves, or my preference, mittens, boots, scarves, hats, earmuffs, all those things to prevent the cold exposure.
Dr. Weiner says that being out in the cold unprepared, or for too long, can lead to first-degree frostbite, which is known as frostnip.
That's usually reversible after warming, so if you're somewhere that you can go inside to a warm environment, definitely do that. If you have something that is cold on you, meaning you're wet, or ice, that has to be removed, so take that away. And then start warming passively with blankets, insulation, and then you can do warm water baths, which is about 100 or so degrees, not hot water, to gently rewarm the affected digits. If the symptoms go away, the redness goes away, the feeling comes back, and the pain goes away, you don't necessarily need to come to the hospital.
But for the more serious cases, Dr. Weiner advises that children should be seen by a doctor for evaluation.
If you have second degree or higher, which is really what frostbite is, where it's getting white, waxy, very painful, those will need to be followed to make sure that the damage doesn't cause anything permanent, to make sure that you don't need any surgery down the line to remove dead tissue, and ultimately we want to make sure that you're not getting gangrene or necrosis, meaning dead tissue, that ultimately would need to be amputated. So any signs of true frostbite needs to be seen by a physician.
This has been the Healthy Kids Minute.